Hey everybody, thanks so much for joining me and listening in. Today, something I want to talk about is sleep. And sleep is a really big topic. It's complex and it's hard to discuss briefly. So for the purposes of this, I'm going to just try to keep it as brief as I can and just kind of do an overview. And please reach out if you have any additional questions, because this is really just kind of scratching the surface. So here at Clear Fork Pediatric Dentistry, we ask about sleep quality and the quality of sleep that our little patients are getting, because we believe it can provide key insights to oral function, believe it or not, particularly if our patients sleep with their lips parted and they're moving air through their mouth. And it can have certain consequences, and they don't have to have their mouths gaping open. You just have, like, even if they're parted just a little bit, and even if they're open during the night, even just 10% of the time, that can have an effect. So when we breathe through our noses, the air is warmed, filtered, humidified. That's really great, especially now, for capturing any allergens, bacteria, viruses, and it facilitates like the appropriate volume of air. And that helps us to get deeper diaphragmatic breathing and allows for those deeper stages of sleep, those like stage 3, 4 sleep. Those are the more restorative and detoxifying stages of sleep. And it's harder to wake your child from those phases of sleep too, versus the highly rousable, light sleep that's not as restorative. Often our kids that just kind of stay in those stages will wake up, they're still tired, they're grumpy in the morning. So when we breathe through our mouths, the volume of air is too much. There's just too much air coming in. And that can be really irritating. Just the volume of air alone can irritate the tonsils and make them big and reactive. And then the air is not filtered or humidified like it is when we breathe through our nose. And so that makes it just more difficult for the body to protect itself from the things that we talked about. It also can contribute to shallower breathing from the upper lungs. So when we breathe out through our mouth, this is a really important consideration. It can contribute to this vacuum effect, and that can pull fluid up from the gut. And when that happens, that's acid, right? So you pull that acid up as you exhale, because that exhale is so powerful through the mouth. And that is an irritant down at the back of the throat, the back of the palate. And that can make those tissues really irritated. It can make them inflamed and floppy. And that can contribute to, if time goes on, it can contribute to what's called an elongated soft palate, which can contribute to obstructive sleep apnea down the road. But it also can just contribute to snoring short term, because it just creates kind of like a redundant tissue. And this laryngeal pharyngeal reflux, or like a silent reflux, is just real irritating. So you might hear that like when your child wakes up in the morning, they almost feel like they've got something stuck in their throat. It might be hard for them to characterize. So they might wake up and go, just kind of make that throat clearing sound. So you might hear that when they wake up. Then, believe it or not, this can even contribute to bedwetting for similar reasons. That vacuum effect can pull the fluid up from the ureters. And then often kids will be sleeping on their back, and it's very positional if their mouth's open. And then they'll turn over, close their mouths, and then that vacuum seal is they're sealed back up, right? So they kind of lose that pull, and then the fluid is released, and the baby or the child voids and wets the bed. And that can be something that's really tricky for kids, something that's embarrassing for them, and something really that's out of their control. In addition to that, there's also hormonal changes that occur from mouth breathing while we sleep. And it really relates to an overworking of the heart and some hormonal dysregulation between like a factor that comes from your heart and an antidiuretic hormone in your brain. And that dysregulation can promote bedwetting as well. So, all of this to say, this is something why we ask about sleep and why we ask about these things, because there can be things that we can do to help. We can really try to help improve that oral function, help patients get their lip seal, and help them improve their quality of life, because as we all know, sleep is so important. It's so important to growth, development, good cognitive function, behavior, all those good things. So, I hope that, if you have any questions about that you'll feel comfortable reaching out. So thanks so much for listening. I know this was a long one, and we look forward to seeing y'all back soon. Take care.